Today we're going to be talking about joint pain, joint arthritis, and the most common question I get, do I need a joint replacement? First and foremost, I believe it's important to understand that the most common reason for a joint replacement is arthritis, most commonly osteoarthritis, otherwise known as wear and tear arthritis. Arthritis to an orthopedic surgeon is not just a joint that's swollen and painful, it's actually the physical loss of articular cartilage. Articular cartilage is the surface on the end of the bones that provides a nice, smooth, frictionless surface for the joint to move in space and move freely. And the loss of that articular cartilage is what we call arthritis. Now, it's important to note that once that articular cartilage has been lost or worn away, there's no way to regrow or replace that cartilage that's been lost. There's no injection, there's no pill, there's nothing to regrow that healthy cartilage that's been lost. Additionally, since arthritis is the loss of the cartilage, there's no surgery to go remove the arthritis. So what are the symptoms of arthritis? So generally, it's a gradual increase in pain, increase in stiffness. You may feel some popping or clicking of the joint. You may experience some weakness of the joint. And over time, these symptoms get gradually worse. Generally, the first step in evaluating a painful joint is obtaining x-rays. Arthritis on x-rays is demonstrated by joint space narrowing, so narrowing the space between the bones, bone spurs or osteophytes, subchondral sclerosis or hardening of the bone, or subchondral cysts. Now, it's important to note that the x-ray findings don't always correlate with patient symptoms. It's important to truly treat the symptoms and not the x-ray. If the x-rays do not demonstrate these findings, but there may be evidence of other cartilage injuries of the knee, you may be a candidate for what I call joint preservation treatment options as opposed to joint replacement options. There's a wide variety of treatment options for joints with arthritis or osteoarthritis. The first step is simply acknowledgement. You can live with the pain. The arthritis is a progressive problem, but it's by no means a life-threatening problem. It is certainly reasonable to acknowledge that the arthritis is there and live with the pain. Other options include anti-inflammatory medications like ibuprofen, Advil, Aleve. There are some other prescription medications out there as well that patients do well with. The next step in options would be bracing. There's various bracing options. Some are just compression sleeves that provide compression to the joint. They help with swelling and inflammation. There are different kinds of unloader braces that help unload certain areas of the joint. The next step up would be an injection, and most typically it's a steroid injection or a cortisone injection. There's other injections out there like viscosupplementation injections, platelet-rich plasma, which is also called PRP, or bone marrow aspirate, which some people call stem cells. Now, the goal of all of these injections is the same. It's to decrease the inflammation and decrease the pain in the knee. None of these injections have clearly shown to regrow the cartilage or reverse the arthritis. It's to really help manage the inflammation and the pain in the joint. Once those options no longer provide significant relief, that's when we start talking about the surgical options. And really what we're talking about here is joint replacement. And in some aspects, there are partial joint replacements and total joint replacements. I often get asked, is there anything I can do to stop the arthritis or slow the progression, or can I make it worse? And generally what I tell patients is there's not much to do here. The goal of these treatment options are really to manage the pain and not manage the progression of the arthritis. Really, the three things I tell patients that they can control for the overall health of their joint is staying active. Motion is lotion, as I say. Keeping the joint moving, keeping it active, and just a general active, healthy lifestyle. The next is your diet and your weight. Simply the force that goes through the joint with every step or every movement that you make. Lastly is tobacco or smoking. Tobacco is harmful on the collagen throughout our body, and therefore affects the cartilage and the ligaments and the tendons around the knee joint, and it can exacerbate the inflammation caused from arthritis. So that brings us to the big question: do I need a joint replacement? Joint replacement is helpful to patients with arthritis who have exhausted all other conservative treatment options. Some patients with other cartilage injuries may benefit from joint preservation treatment options, and that's something to be discussed with your orthopedic surgeon. The indication to undergo a joint replacement is a shared decision between you and your surgeon. It really is about your pain and your function. It's not an X-ray finding. It's about your symptoms, your expectations, and what you expect out of your joint. When you've tried all other conservative options and you can't live with the pain or you can't live with the function, that's when it's time to start considering a joint replacement.